17-year-old Brianna Stanfield has suffered from epilepsy since birth. Despite trying a number of different medications, she still has regular seizures. She has had 4 seizures over the past week.
I don't get to go certain places or do certain things because of my epilepsy. Like, I can't hang out with my friends, go different places because my mom is afraid I'm gonna have a seizure.
George Nickel developed epilepsy 4 years ago. It forced him into early retirement.
Can't drive a truck anymore like I used to, and I'm afraid to get up on a ladder and do maintenance on my house. There's just so many things that I can't do anymore.
Can you hear that okay?
Currently, clinical research centers across the U.S. are looking for people like Brianna and George to take part in a clinical trial for a new investigational medication. Importantly, for this clinical trial, there is no penalty if the research doctor is outside your insurer's network. For those who qualify for this study, all study-related specialist care is provided at no cost to you.
In epilepsy today, we have multiple medications to pick from, but we need more choices. We need medicines that control seizures and that are well tolerated. I'm one of 70 doctors participating in clinical trial for medications. Medications work different in patients with epilepsy, and those patients with partial onset or focal epilepsy can participate in a clinical trial which is referred to as adjunct. We add on the medication to their current regimen and assess how well they do, the side effect profile, the tolerance.
Doctors are currently enrolling people aged 16 and over with a documented diagnosis of partial onset seizures. They want to see if this investigational treatment works when it is added to anti-epileptic medicines that people are already taking. To qualify for this study, people with epilepsy must be taking 1 or 2 anti-epileptic drugs and have had at least 4 seizures over the past 4 weeks. To see if you qualify for this clinical trial, go online to epilepsyclinicaltrial.com.
I got a seizure diary that I write them all down in, and every time I have one, I write it, and the type it is. And I'm trying to control my epilepsy completely.
If you have been diagnosed with epilepsy and you experience partial seizures regularly, even though you are taking medicine for it, visit epilepsyclinicaltrial.com today. That website again, epilepsyclinicaltrial.com.